your left shoulder against the board and then look towards the wall. No, left shoulder against the board, lateral. Yeah, there you go. Try and depress the shoulders as much as possible. Sometimes if you see them in a stool like this, what you can do is grab the stool and raise up, okay? Because that'll bring the shoulders down more. All right, so where's the central ray?
7th.
C4. We're
C4.
all central rays for cervical spine are C4 except for the open mouth and the swimmers. Okay, so we'll go a little higher. Okay, and I told you guys to collimate just above the EAM and behind the eye. Okay, so there's your lateral. Put your left marker. I always do left laterals. Okay, it doesn't matter about the affected side. Okay. Now, for flexion extension, go ahead and tuck your chin into your chest. All the way. Okay? That's your flexion. Okay? Now stare up towards the ceiling. All the way up. Okay? That's your extension. Okay? Okay, now go put your back against the board. Okay, now we're doing the obliques. Obliques going to be how much cephalic APs?
15.
15 to 20, right? So again, you want them to turn. Always put them in an AP first, okay? And then turn. Right there. Okay, now look towards me. Okay, you guys straight. Okay, got a little magnification because of the OID. This is why we shoot them at 60, not 40. Okay? So there's your AP, RPO. Okay, go ahead and turn the other way. Okay. Okay, there's your LPO. Okay, go ahead and turn around, face the board. Now if I do the caudals, what's changed?
Triangulation. 15 down.
15 down, right? Now, it's kind of hard to do it on this. So we couldn't do this on Carlos or Chad. Go ahead and put your right shoulder against the board. Right, look towards me.
This is for PA.
PA oblique, right there. Okay?
15 to 20 down.
Do the other side. So there's your LAO, okay? So both obliques. And then I'm going to bring it in and do an AP axile. So again, 15, 20 up. Go ahead and face the tube. Okay. Since I'm at 40, you're going to change 10 by 12. You're going to have some elongation. So just like that. Okay, so that's your AP.
10 by
Axile.
12?
Uh-huh.
Actually, that's CR.
Central rays at C.
Open mouth.
C4, yeah.
Now, we guys, a lot of places you go to do the open mouth, you guys are gonna do it on the table, because when you lay on the table, your head's naturally gonna go all the way back, and your chin's gonna tuck, right? Because what you don't wanna do is have your head back like this, because the occipital is gonna be in the way of the dens, right? So you have to keep your teeth and your occipital out of the way of the dens. So if you bring the patient back, laying down like this, and drop their mouth, all the way back to your head against, see, how his head's up, is that bad?
Yeah.
Yes.
Okay, that's bad. Okay, so you're gonna have to bring them down, down, down. Okay. Then open your mouth. So again, when they open their mouth, when they're standing up, they wanna bring their head back more. So open your mouth, okay, drop, like that, okay? Say ah. So it is kinda, especially if you have an injury, it's painful. But there's other methods of doing this. There's a Fuchs where you don't open your mouth and you shoot under here. Okay, so if I knocked out his teeth, there's upper palate and the lower of his ear right here, you can feel a little indentation right here. Everyone feel that indentation? Right? Guys, who wants the body?
Andrew.
Okay. Guys, everyone, feel behind your ear, you feel that little indentation right there? Okay, that's your mastoid tip. Okay, right below the EAM, which is your external acoustic meatus. Okay. So the upper incisor, which is pretty much right here, I mean your upper palate, okay, and this should be in the same plane. Okay. Okay, so that's your open mouth. Then we're gonna do a swimmer's. Go ahead and look, turn towards the wall. Your left arm up, over your head. Okay, guys, you want as close as possible to the film when you guys do this. Okay, drop your shoulder. Okay. Okay. This is C7T1, right? So stay right there.
What is C71?
Okay, got 10 by 12.
C71.
Okay.
So this is the cervical thoracic. This is swimmers.
Oh,
If they can't depress the shoulder like this, then you raise this and you angle. Okay? That's not on your test or anything like that, but when you guys get out to the world, that's what a lot of people are going to be doing. Okay? All right, relax. Your arm down. Now we're going to do pretty much a lateral chest, right? So again, hold out your arms like you're holding a pole. No, in front of you.
no, stop.
I would drop the bucky, but we're not going to waste time right now. So right here, where his inferior angle, okay? Equivalent to T7, right?
T7.
Okay, we have 14 by 17, so I'll collimate to about 10 by 17. Now, always get the posterior spinous process, because remember, you got to include the posterior ribs, okay, because that's how we tell rotation, right? Now, the breathing technique for this is going to be short, shallow breaths. Okay, make sure you guys add that onto your cards. Short, shallow breaths. Now, one of the eval criteria was that the first 3 vertebrae aren't really seen, right? So we're not too worried about the 1 through 3 because they're not well visualized anyways. Okay, that's why we do the upper one. Now, the top of the cassette's going to be where?
1 inch and 2 inches.
1.5 to 2 inches above the shoulder. Okay, so this is your lateral T-spine. Okay, then we have an oblique. Go and put your arms down. And you put this over your head. Okay. Again, I could do anterior or posterior. I'm going to do LPO. So I would just turn them how many degrees?
45.
20.
20 for this
20,
one.
20,
20.
20, 20.
Right, just 20. So now I'm going to LPO because his left posterior is touching.
20 from the
Okay. If I turn 20 this way, that would be a LAO.
I mean, LA, right?
Left shoulder's on the board, right? Okay, so we're doing an LPO, just like this. Okay? Okay, so just like that. 20 degrees posterior or 20 degrees anterior from the lateral. Okay, if I was doing an AP or PA, how many degrees would it be?
70.
It would be 70. Okay? So 70 and 20 make 90 degree. Okay? So this is your LPO oblique. Only do 1. Okay? It's easier if you have them left lateral, just turn like this. There's your oblique. Okay? Go and put your back against the board. Arms down. So we don't have magnification anymore from the OID. So we could raise this to 1.5, 2 inches above the shoulder. Okay? And there's your AP T-spine.
T5. That's the T7. Or T7.
T7?
I think, is that T7 correct? Yeah.
Yeah. All right, I'm gonna give you guys an order. So Al's gonna